Obviously for 2 weeks, I think this is for 2 weeks. 2 weeks for 1 day for oral medication, another day for ANP, and another day for injection. So more or less 3 or 4 days, all medications. Okay, and
2 days for injections.
yeah, so more or less 4 days for all medications. Okay, so our first procedures related to medication is on oral medications, specifically tablet capsules and also liquid medications such as syrup and suspension. Okay, now this is what we want you to emphasize in your group, specifically the 10 rights of medication administration. Because I think before it was not 10, but now it's 5 or 6. But now, they keep on updating. So this is the recent one. I do not know if there's 11, but so far in the book it's 10.
Maybe it's 12.
Okay. In particular, in your own group, we wanted to emphasize the importance of each rights to medication administration and how we apply it when we administer the medication itself to the patient. And the first one is the right patient. And in this right, specifically we emphasize the importance of using this patient's label because it has 2 identifiers. See, use 2 identifiers, specifically the name of the patient, which is 4, and the MRN number. Okay? Name in the order itself. That's why when they go to the bedside, they're bringing this chart with the name of the patient. Okay? And then they identify the patient using this sticker label. This is how they can observe the right patient. And of course, we have to check also the system. The MAR, it has labels of the patient. And the second right is right to medication. You need to teach your students how to properly read the labels of each medication. And you have to emphasize that there are 2 important names that they have to read, the generic name and the brand name. Especially that there are a lot of medications that sounds alike and looks alike. Okay? You need to tell them this is the generic name, this is the brand name, and this is very important, etc. All that was discussed already in theory. But you need to show them the different medication and the different labels. Okay? And the second one is I want you to emphasize and I want you to ask your student to look at the MAR itself. Because it is where they can find the complete list of the medication itself. It is where they're going to see all the list of prescribed medications. I think you have this copy in your... Yes. And the first column specifically are listed all the different medication, prescribed medications of the doctors. Okay? First, the medication label, and the second one is the physician's order. Okay, I think this one has been discussed already. As I mentioned earlier, let your students be familiarized with the package of the medication. Let them know which one is the generic name and which one is the brand name and why it is important to check the 2 names. Okay, this one is seldom being implemented already because in the hospital, when the doctors prescribe a medication, it's automatically uploaded in the system. But there are some institutions that are still using the traditional physician's order or the prescription order of the doctor. And it is important to inform them what are the different important components of the physician's order, what should be written there. Okay? And they should question if there are missing items or details in the prescription order. But in the hospital, once it is ordered, automatically it is uploaded in the MAR. But when they go to the other hospital, perhaps they will still see this one. Students should know this one because in theory we discussed this. Right time. This is very important. And the most important thing that the students can do is to check when was the last dose was given. And they have to go back to the MAR. Because in the MAR, there are columns of timings where they can see when was the last time the medication was given. and emphasize to them why is it important to check when was it given, because we do not want to double the dose. We do not want to overdose the patient. And there are prescribed timing or frequency that we follow. And I want you to direct them to the MER. These are the timings, this is for the morning shift, this is for the evening, this is for the night. And how do you know if the medication is given? You will see timing and the initial of the nurse. This is very important because most students, especially exam, they might be confused. They do not know where to write their signature. They do not know how to check the previous administration of medication. Okay, as I mentioned earlier, it's there. I think you will be given. By the way, the MER that we are using here in the lab is exactly similar to what we're using in SQUH. It looks like that also. So they will not be confused when they go to adult one or higher level in nursing. So it's there. Okay, the first column is the medication, and then the route is there, and then the schedule or the frequency, 3 times a day. Even the quantity to administer is already there. In some instances, students need not to compute anymore, but of course, we need to emphasize that. And the processing notes, what are the things that they're supposed to do, or they have to assess, or they have to check. And the last 3 columns are very important because it indicates the timing, morning, evening, and night. And there's specific timing there, and it is where they're going to affix their initials. This is very important, especially exam. If the students write in a wrong column, wrong.
Always in the middle column, because it's in the daytime. They are always in the lab, exam, everything in the daytime, no? So show them that 7:30 to 2:30 column. Always recording will be there.
Yeah, but students will still jump to evening or jump to night, especially exam. Okay. The frequency, this is very important. See, this is on the right time. Although in the hospital, I think it is less frequent that they are using already the abbreviations. I know we have a lot of abbreviations, but I think in some other hospitals in Oman, they're still following these abbreviations, like the STAD, BID, etc., etc. But in the MER that we have in the hospital, I think they're using the complete.
No shortcuts.
This
They're
one.
writing 2 times a day, 3 times a day.
Which hospital in SQ?
Yes.
Okay, because other
hospitals.
Yes.
Yeah.
In other hospitals, they're still using the abbreviation.
Yeah,
And
SQH also, no TID, OD and all. Twice a day, once a day.
But
they are
Masarra, they're still using the TID, VID.
okay.
All the
Yes, I think
AFH also
Royal
is
Fountain.
Yes. And also emphasizing to them because in prometrics, they're still using the abbreviations and they will be taking prometrics. Yes. Just tell them the exemption is here, SQUH, but emphasize to them this one.
Yes, they have to know.
Yes. This one is the most important one, and most students, if they fail to do this, they will automatically be unsafe. The right dose, or the right amount or weight of the medication. And the thing that they have to do in order to follow this right is, of course, to check the order, to check the MAR. What is the quantity to be administered? How much tablet or how many ml or how many milligrams, etc. They should check the order. And also emphasize to them that if they feel that the order is questionable or it might be too high for the patient or too low for the patient, in the hospital SQUH, in every medication trolley, there's always a drug reference handbook to check. Especially if the patient is pecha and the order is too high and they might say this is too high for my patient. Empower them to use this one because this one is seldom used in the hospital. Just automatically carry out the order without checking if it is appropriate or not.
Student has given us the
Yeah, students have this one.
We carry it.
So many times doctors write it by mistake or
Yes,
typing,
true.
typo, mistakes. So as a nurse, they have to be
Yes.
But here there is one more system for the doctor also. The moment they put the name, I think it automatically comes. Adult dose means that particular dose, that medication appears.
Okay.
It's made easy for the doctors also here.
To check.
They have different system here. So.
Yeah, but in some hospitals without
No.
that mechanism, nurses should, should be assertive.
Especially
First time
Or
or
the
no nurses they double.
even though they
Yeah.
have
Even though it's in the computer, they double
calculate
check
the
the
dose.
dose.
Senior nurses always.
All the
medication.
nurses. And sometimes there's a medication nurse. She will check all these things. So they still double check.
Okay, I think this is the most important. How to calculate the dose? This is the standard formula that we are using, D or over H times quantity, and students should learn how to calculate. Because when we give the medication, when they carry out the order, they're expected to give the right number of tablets or the right ml. And this is a critical element of this procedure. If they fail to give the right amount of medication, automatically they will be unsafe. Okay? These are just examples, but we don't have students, so I'll just scan quick. Usually we give some short exercises to students. I think we can do that. We can prepare a few questions, we can give it to you. And if your students have free time, you can ask them to answer.
Because there is a procedure, it says drug calculation. You need to sign that.
Yeah.
Don't sign on the first day.
Yes.
Let them finish injections also. Let them know all the calculations. When you are sure, you give them. So we will put all together. Some tablets, some syrup, some injections, and give you all one worksheet.
But they
Just 10
learning
Yes,
these
please.
equations in the theory.
Everything they are doing in theory, we are giving a test also, everything is
Yes.
there. Just for your exercise
Practice.
and the common ones.
Yeah, actually I put a lot, but
It's there, this PowerPoint is there in the Moodle. You can use it also.
okay. I think this is the 5th or 6th, the right route. You check if the route or the order route is appropriate for the patient, and if the patient is able to take the medication with the prescribed route. Okay. Students know already that there are several routes where the medications can be given through injection, mouth, topical, inhalation, etc. etc. Maybe what you can do in the day itself is you can ask your student what are the possible routes, just to do some quick review if they can still remember all these things. And this is very important, the right assessment, and this should be done before the medication is given. And this is the common mistake of the students, right assessment. And normally we do the right assessment just before we give the medication. Okay, now what are the things that we assess before we give the medications? Or even before we prepare the medication? Okay, allergies to medication. We normally ask the patient, do you have any allergies to medication? Do you have problems with swallowing? Or try to observe if the patient's already ate her breakfast, that means there's no problem with swallowing. Presence of nausea and vomiting, NPO, NGT, the student should be able to ask all those things or assess or check the chart. Assess client's knowledge about the medication. Later on, I'm going to demonstrate and show you how I'm going to assess all those things. Perform assessments. Okay, this is very important. Perform assessments specific to medication. For example, if the medication is for fever, the specific assessment is checking of temperature. If the medication is insulin, the specific assessment should be checking of blood sugar in addition to the other things that I've mentioned. Or the medication is for hypertension, the student should check the blood pressure prior to giving the medication. Or pain scale or pain assessment if the medication is for pain relief. Okay? And other relevant lab results. Okay, this one is also part of it. When I was a student, there's no such thing as right to education.
Comes separately.
Yeah, before it's only 5. Right education, even before you give the medication and much more after giving the medication, you expect students to be talking a lot with the patient. Specifically, we need to tell the patient what's the purpose of this medication, why is it given, what is the desirable effect, what are the possible side effects, those things. The student should be able to ask the patient about those things. This is also new, right, or refuse. Okay? You just need to emphasize to students that patients has the right to refuse. However, when the patient refuses, it is very important that the nurse should explain what are the possible consequences. These are the things that would happen if you're not going to take this. Your blood sugar level will be high, or your blood pressure will be high unless you take this medication. Inform the patient about the consequences. And notification of the physician is very important. And most importantly, the documentation of the refusal. That once the patient refuses, they have to go and document that the patient refused. And it is very important to emphasize to the students that the documentation will serve as your protection as well for any future litigation in case something happened to the patient because of adherence to medication.
And never recommend before
Yes.
giving. Yeah, it happened.
Yes,
How many times?
we have a specific rights for that documentation.
Yeah.
Okay, so going back to her, the next rights is documentation. Never document administration after giving the ordered medication, especially when the nurse has to give a lot of medication and they have to document it in advance. Okay? Because it is very important for them to learn that there are a lot of things that could possibly happen to the patient. Okay? During the span of time. That's why documentation should be after.
After every procedure.
Yes. Chart the time, route, and any untoward reaction to the medication administered as well. Okay? Oh, we still have. Okay, this is connected to assessment that we have done earlier. Okay? Evaluation should be done after giving the medication. And primarily, we do the evaluation to assess for any adverse side effects. Or of course, to assess if the medication given is effective or not. Now, this is very important evaluation. If the medication, for example, is for temperature, part of the evaluation is checking for the temperature. Or if the medication is for blood pressure, part of the evaluation is checking for the blood pressure. Those things. And if the medication is insulin, part of the evaluation is checking for any signs of side effects and the effectiveness of insulin. There's hypoglycemia or whatsoever. Okay? And compare prior status with the post-medication status and document patient response to medication. Okay. So those are the rights. Okay, so we have two medication trolley here, and it is very important for the student to